So I'm excited to talk about back pain. We're going to get into just kind of the mechanics of it, as well as some new technology that we have. And I have a lot of questions that I have written down from people that were interested in learning more. So we'll go through those as well. So some of the things that we're going to be learning today is why pain pills, medications, injections, and surgeries don't always work. Now, there are times that we're like, I think this is going to be a time where you're going to need surgery, but it's so rare that even happens in our office. But it does happen. We're not against surgeries when they're needed, but we think that there are just way too many surgeries that are happening, and that's kind of what the research is showing as well. Why MRIs and imaging leads down to more unnecessary procedures. We'll go into some common diagnoses that we get that can be a cause of your pain, such as arthritis, stenosis, degenerative changes, those kind of things. And then, kind of what other healthcare providers miss in helping you get back to living your life and staying active and mobile. And then, we're going to learn how Shockwave has been helping our patients take away back pain and specifically SI joint degenerative pain. And I know we have the question about degenerative hips. And yes, the focus shockwave can go deep into the hip joint to help with some of the degenerative changes. And we'll get into what those look like and why it all works here as well. So some of the things we'll get you at the end of this, we will get you a back pain guide. That's fantastic. We also can get you like a written form of what regenerative therapy is. Some people like to read things as well. So you'll get those at the end of this. For some of those people that just don't know me, I have been a PT for, oh my gosh, let me think. 25 years. I don't feel like I'm that old to be practicing for 25 years. But I was always the person that was like super curious and always asking why. Why does that happen? What can I do about it? That's how I am with my health. That's how I am when I go to doctors. I'm like, if you're going to tell me I need to take a pill, there better be a reason for me to get off this pill. You've got to really explain everything to me in order for me to want to take that pill. Like I want to heal my body naturally if I possibly can. And I am constantly learning from patients constantly because we're always, moving people and trying to figure things out and putting a lot of the pieces of the puzzle together. That's really what we specialize in. We get some of the crazy cases, and we've been able to help a lot of people get out of pain. I've also written a book. We have clients that fly in to see us from all over the United States. And one of the things they're like, I wish you would put an office in like California or St. Louis or Oklahoma. And so I was like, you know what? I'm just going to write a book. And so I wrote a book basically on all the different ways that we feel pain. We're going to touch on this a little bit in this talk as well, because if you miss the wrong category, then you're just treating a symptom. And we're going to get into what that looks like. But the book has a lot of like patient stories where people can really see themselves in those stories. So this was just a client that we had probably like 4 years ago. Massive pain, literally could not walk 100 yards without needing to stop. And he was at the time 45 years old. He had been going through probably 10 years of pain management, which basically was just drugs and more drugs and more drugs. And so much so that when he found our office, we were able to get him out of pain. It did take a while because he had been in pain and been on drugs for so long that his tissue was so, like once we were able to get rid of the pain, he was so weak that it took us a while to get him back to being able to be active again. But because he'd been on the medications for so long, he ended up having to go into rehab to get him off the medications. It was horrible. But his life, he's doing great now. Actually, I mean, he's doing Pilates and yoga, and he lives in Italy now, just living his life. But he had no life before coming in and seeing our therapist. Just want to kind of give you a little bit of the back pain statistics because it's kind of crazy. The total cost of back pain per year is $34 billion, which is crazy to me. And let's go into kind of like the average cost of an injection. is $1,200. The average cost of an MRI is $1,500. We'll talk about like why you would not want to do some of those things. They have purposes, but a lot of times they're overutilized. The cost of PRP injections, $500 to $2,500. The cost of stem cells, $8,000 to $10,000. The cost of surgery, like a fusion, is $100,000. And our healthcare costs have risen over 50% in the last 10 years. So our goal is to help you spend less in healthcare and understanding your body a little bit more so that you can be proactive in helping you feel better. Healthcare costs is 60% higher when you have back pain. Oftentimes, one surgery leads to a second and third surgery. We had a client that had come into our office and um, when he went to go see the doctor, he had back pain, and the doctor goes, "Well, how long has this been going on?" He goes, "Well, off and on for a while." And he asked him if he had therapy, and he said, "Yeah, maybe 5 years ago." And so he just was checking the boxes off for insurance purposes, and basically said, "Well, let's go in and do surgery." And he was in the waiting room, and every single person in the waiting room was on their second or third surgery. And he was like, "Oh, I don't know that I want to do this." And he gets into the ER room, and the nurses ask him, "What's your pain level?" And he goes, "Zero." And the nurses' faces were like, "What?" And he goes, "No, I don't have pain in the morning. I have pain as the day goes on." And so when the doctor came in, he goes, I'm not going to do this. He came into our office, and I think it was like 6 visits, and he was like back to feeling great. He knew what he needed to do and was doing fantastic. So a lot of times when you have these surgeries, we'll get into some of this stuff, it's because no one ever gives you the education of what you did that caused it. A lot of times when people have back pain, they're not like, "I'm not sure what I did. It just started hurting one day." And those oftentimes are ones that you have to find someone that understands the body so that we can teach you what you're doing throughout the day that's creating some of the issues and coming up with a game plan around it, but also giving you tools to feel good. We also do 200% more surgeries, back surgeries in this country compared to any other country, which is just insane to me. So, what are some of the causes of lower back pain? And here's some of the myths and some of the common causes. So, myths that we see all the time is that your core is not strong enough, and it's really not true. Some people can't even get their core to fire because they have so much pain. You've got to get into why it's hurting before you can even get into any kind of strengthening. Now, once when you're feeling better, obviously strengthening is going to be a great piece of it, but it's not core strengthening is not going to fix the back pain. Losing weight also does not fix back pain. There's no research showing that. I'm not even sure why doctors tell us this. Now, knees completely different because it's a weight bearing joint, but backs. I can tell you that most of the people that come in with back pain are not like massively overweight. A lot of people that are overweight massively, that their tissue actually keeps the spine in a much better position. So a lot of times they don't have as many problems. Poor hamstring flexibility is also not a problem. Usually there's a lot of combination of things. Bending your knees to your chest to stretch your back. We see this all the time. A lot of times you'll go to PTs and it's like, let's bring your knees to your chest so we can stretch out your back muscles. The back muscles usually are just symptoms or symptoms of something else that's not moving, something else that's going on, something that might even be degenerative. Massage is not always a solution. So I always tell patients, I love a massage. There's definitely a place for it. But if you get a massage and that's all that you're getting and your pain comes back within like hours to a few days, then the tissue that they're massaging is just a symptom. You've got to get into why is that tissue tightening up. And so it's a good indication if you have any kind of issues going on anytime in your life, and you go and get a massage and your pain returns pretty quickly, that's going to be the first sign of, oh, I need to get to someone that's going to be able to figure this out because that tissue is just a symptom. So, what are some common causes of back pain? Our repeated postures that we do every day in and day out, are what causes a lot of what we do. And if you look at it like when we're kids, we're running and we're moving all over the place. But as we get to be adults, it's we sit, we stand, we bend, we sit, we stand, we bend. I mean, like that's like the repeated motions that we do all the time. And oftentimes it's the repeated motions of the bending that we do from the sitting in a couch, sitting in front of a computer, bending, doing yard work, bending to clean. We're doing these things all the time, and it creates problems where it puts pressure in the back of the spine that gives us a lot of issues. And we'll go into a little bit of that here in a second. Sedentary lifestyles, our joints are meant to move. Our joints feel better when we move. And so if you have something that's not moving, that's one of the big things that we do is to get things moving again so that then the body moves more fluid. You'll have a lot less stiffness when that happens. We had a guy that literally couldn't sleep in his bed because his spine was so stiff. He was sleeping in a recliner and had all this back pain. And the doctors are like, "Yeah, this is just what you're gonna have to do." And I'm like, "Is it?" So we literally started mobilizing his back and teaching him how to do it from like his like upper back all the way down to his lower back. And after about a month, he was back. I was like, let's go and just take a little nap in the middle of the day and just see how long you can last. Like don't sleep all night, but let's just see if you can take a little nap and you can actually sleep in your bed. And he was able to, and he's back to sleeping in his bed. But no one ever told him that if we that we could actually get things moving and that stiffness would go away and that he actually could lie flat again. Degenerative changes that happen in the back and the SI joint also are common causes of this, and that's where shockwave gets to be a really good tool for us. So when you talk about the disc, I was sharing a little bit about like when we're always bending, you can see that we have these discs are in the middle through here, and we have nerves that go in the back of the spine. And these back part of these discs, it's actually the weakest part. So when we're actually bending forward, you can imagine bending forward in the front part, you can move everything to the back. But if we're constantly moving in like forward and backwards and in a lot of different directions, it will keep everything in, all the material in the disc is going to keep it pretty centrally located. But if we're always bending and bending and bending forward and bending forward, what happens is that material will start migrating to the back of the spine. And that's where we'll start having issues where you can get these herniated discs similar to this. Sometimes you don't even have a herniated disc. It's just that the rings that go around the disc get damaged. And then that hurts. So every time you put pressure on it, you feel pain. But you aren't sure, like, I'm not sure how I can move to make me feel better and worse. Sometimes you do. Sometimes we ask and like, yeah, I can walk and it feels so much better. I'm like, awesome. We already know what direction that we need to go into. Or if I'm sitting, I feel worse. Or if I'm sitting and I try to stand, I can't stand and reverse the direction. It's because you've been sitting there and all that material has migrated to the back. And now when you try to reverse the direction, there's material that's in the way. So it makes you feel stiff and you feel like you're 80 years old standing up. But that doesn't have to be the case. We've seen many people we've been able to help not have any of those problems. So this was a client that had a 9-10 millimeter herniated disc. Literally like it was bad. I'm not gonna lie. It was really bad. And the doctors wanted to do surgery, but he had to do therapy first. And he was like, well, let me just go and find a place. And he happened to find our office. Someone told him about our office. He was in so much pain, he took an Uber to our office. That's how much pain he was in. He was having a hard time working at all, much less functioning, doing anything social or anything outside of work. But essentially his herniation was so big that if we tried to actually go into a little bit of extension, like flexions forward, extensions backwards, we would pinch on his herniation because it was so big. So we actually had to put him over pillows. So we put him over some pillows to kind of open up that space and slowly dropped the pillows to reverse the direction. And it reversed everything. And in 5 weeks, he was at our office around Thanksgiving, just before Thanksgiving. And by Christmas, he was able to spend time with his family and get back to work. He wasn't 100%, but he was like 80% better. Like he would have said he would have lived at 80% better with the way he felt before coming into our office. But he got back to everything and has no problems and knows what to do. But it's possible when you have big herniations, as long as the rings and everything are intact, we can adjust how that herniation is based on movements that can help us. We if it's if rings or the herniation, like there's like a rupture in the disc, your presentation is going to be completely different. You'll have a ton of leg pain. A lot of times you don't even have back pain, but it's unrelenting. You can't change your position to make it better or worse. I've only seen one case where I'm like, yep, I would have surgery. If it were me, I would have surgery. You literally have ruptured your disc. Now we can wait for it to scar down and then start remodeling that scar tissue, but that's going to take way longer than you just going in and having surgery. So here are other common things that we see. So we'll have things like stenosis, and people will come in with a diagnosis of stenosis, and we're like, okay, well, we're going to test it out. Typically, when we ask patients, because we can ask like, what makes you better, what makes you worse, and that gives us indications. Typically, with someone with stenosis, sitting will make them feel better, and they won't be stiff standing up at all because they like the flexion because you're basically opening up the space in the back, which is where you'll get some of the bony changes that happen. But oftentimes, there's not very many clients that came in with stenosis that I was like, this is not stenosis. You're not presenting like stenosis. And even if you are presenting a little bit like stenosis, if we can improve your mobility, the amount of functional improvement that you have with your ability to be able to walk and do things and not have pain is huge. And so when we have people with stenosis, again, we have to almost like put them under pillows and we monitor their symptoms to start reversing the direction and opening up, making the joints to kind of move. It's much easier explaining this when I'm actually in person, but just so you know, we can help people that have been diagnosed with stenosis. I've only had one case that I have seen where I'm like, yep, you truly every time we try to move you into a little bit of extension, you have it. And so then from there, we're just teaching them how to kind of manage those symptoms. But most of the time, people we can improve their mobility, and a lot of their symptoms go away. Spondylolisthesis. So in this here, you'll see like this step off here where you have all these vertebrae here, and then you have this kind of step off, and then the vertebrae has kind of shifted forward and compared to the one down in the bottom. This is common. We see this all the time too. And what happens when we have people that have this type of presentation when they show us their x-rays, I guarantee you they have a fulcrum where they're just bending their back only in this area. So they're not moving very well above and they're not moving very well below. They're not moving very well in their hips either. And so you'll have this like step off because they're only moving in that one spot. And that makes the whole spine shift. So what we have to do is improve the mobility above the area through here and improve the mobility below, as well as even into the hips. And so, when you do that, then everything aligns and your symptoms start going away. We have seen the same thing with people that have stress fractures. I've seen people that are older with stress fractures from like they had actually an injury. And then I've had people that are younger that would have these stress fractures that like were gymnasts and those kind of things. Same kind of thing. They would have like a fulcrum, and that's where they're taking the brunt force of their spine. And that's where we have to get at, like move things above and below. So there's a lot of things that we can do from a physical therapy perspective. So when we see people, we're always doing evaluation to figure out what is going to be their best course of action. So some of the things that we look at on like fixing lower back pain and hip pain, because they really go hand in hand. Um, and what our healthcare system doesn't look at. So the biggest thing that we always are doing at the very beginning is we're looking at mobility. So mobility is always the first thing that we're doing. Because if you can't move, if a joint's not moving, then you're just going to be going around it, or you aren't going to be able to get certain muscles to even fire. So we've got to improve that mobility. And when you have back pain, you can have lower thoracic spine issues that are not where they're not moving in that lower ribs area that can create back pain. You can have actually the lower ribs create hip pain and it not even have any back pain. We've seen that too before, and we'll show you a picture of why that happens. But we've got to look at the thoracic spine. We've got to look at how the back moves, and we've got to look at how the hip moves. And so these are all three areas that we're looking at. A lot of times we will start with the back because even if we think, oh, that this is definitely, we had someone in today, definitely, I'm pretty sure this is coming from the hip. And, but when we saw him move, he had a lot of movement forward. He could go down and touch his toes, but he barely could move backwards. We're like, yeah, we probably better rule out the back. Most of his pain was in his hip. Didn't have really any complaints in his back. Most of it was in his hips. His back would bother him ever so often. But we went and started doing some like mobilizations to his lower back. And lo and behold, his hip pain went away and even down into the outside part of his leg, his movement improved. So there still is probably a component in his hip. And that's really common. Backs and hips will have like usually we have to treat both. But a big chunk of it was coming from the back. Muscle imbalances and movement. So like when we look at the mobility and then we've got to look at how are the compensation patterns that have happened specifically really in the hips and how the hips are moving because then the back follows the hip. So if you're moving the hip in a weird way because you have some weakness, then your back is going to get affected by that as well. So we have to look at all those imbalances. Muscle tightness. So when everything is moving, then we will get into like what's left over. Is there anything else that's tight that needs to be released because it's been shortened for so long because of like the way you've been moving or the way you haven't been moving, whatever the case. And so we look at like hips, IT band, hip flexors. A lot of times those will take over and a lot of hip issues, obliques, all those things. And then getting into posture habits. So like again, if we don't get into like what you did throughout the day that's creating some of these things, then you go back to those same things and you're going to create your pain. So if I pull my finger back and I hold my finger back in a position and I'm there 8 hours a day and I come out of it, my joints have to recover from that. And then if I go right back into it the next day, and this is the reason why my joints are hurting, I can do all the mobility and the soft tissue and the strengthening that we need to help it. But if we keep on going back in the position that's creating those problems, we're going to continue to hurt. And so those are, again, one of the things that we look at when we're doing the evaluation to give you basically awareness around why this is happening. So this will give you a little bit of a clue on how our thoracic spine why our thoracic spine can be issues because if we look at the muscles here where the ribs are, everything attaches to the pelvis and those ribs. And so if you have tightness through those ribs, you're going to feel it. You can have the tightness in those muscles to refer through here. You can also, because it hits the crest through here, you can also have it where you have pain in the hip. You don't even have pain in the back, but you can get pain in through the hip. We've seen that many a times as well. So that's how the thoracic spine can create back issues and even hip issues. Um, So, how to know when medications, injections will work and won't work? So, I go into like six different categories that where we kind of feel pain, especially with the back. We're going to talk about mechanical pain. We'll talk about chemical pain. Neuro pain would be like nerve pain, like you have a pinched nerve or you have a nerve that's been scarred down. We see that too, and we can solve that problem as well. And then there's other categories that we'll get into. So thermal pain would be like burns and sunburns. So we're going to take those off the plate. But chemical pain is chemicals. Chemicals treat chemicals. That's where medications and injections can help. So if you have a recent injury and you get all this inflammation that's coming to that area and it's that throbbing, aching, constant pain, it has to be constant for it to be chemical, then chemicals can treat chemicals. But here's the problem with that too, is that you've got to get into like, well, why is it inflamed? Now, if you had an injury, you fell, a reason why. But if you're not sure what you did and you're getting all this aching, throbbing, constant pain, then we've got to address the why. Otherwise, you're just going to treat a symptom as well. So a big example that I like to share with people is if you have like a kidney infection, if you've ever had a kidney infection, it's that throbbing, aching, constant pain. Yes, you can take chemicals that are going to reduce that pain and it's going to take it away, but it'll come right back again when you stop taking the pain medications because you've got to fix the infection that's in the kidney. And once you fix that, then you no longer need the chemical the chemicals to help with that pain. Now, you need it to help it for the short term while you're fixing the long term. So there's cases where you do have that constant pain. We're like, yes, go ahead, let's get an injection, so we can see if we can progress you a little bit faster to get into some of the mechanics that's happening. But if you don't have constant pain and it's not that constant aching, throbbing pain, medications won't work. If you can change your position and make it better and worse, or your pain comes and goes, those are mechanical problems. Those aren't chemical problems. And if you're going to throw medications and injections to a mechanical problem, it's not going to work, which is why you'll say, well, it only took the edge off or it didn't really work. It worked for a few days and then my pain came back, type thing. We see stuff like this all the time. So it's why you really have to understand what's going on so that you can really understand what category you're in. Nerve pain would be so when someone has nerve pain, it's not just their pain that goes into the hip. That can be referred pain. So you can have structures that, when it's really irritated, it can refer to different parts of the body. And so it's one of the reasons why we say where the side of the pain is often not where the source of the problem's coming from, because of referred pain, because of how things are moving. But when you get pain that goes down the leg and it's below the knee, oftentimes, not always, but oftentimes, I'd say the majority of the time, that's nerve pain. And so there's things that we can do to take pressure off the nerve. There's also cases where you can get, where you have structures like your disc can like heal into the nerve. So you get scarring, very different procedure on how you fix that, but we can figure that out with an evaluation to know which course of path that we need to do. So that's another type of pain. We have autoimmune and emotional type pain as well. And so we go into some of these things. When you look at mechanical pain, it's very pattern based. You will see patterns in everything. We still see patterns. We'll have people, because we get crazy cases, and we'll be like, oh, wow, I've never seen this before, but it worked. And then all of a sudden you have another patient that comes in 4 months, down the road, and you see a very similar pattern. Mechanical pain has pattern. Autoimmune has no patterns. We can't recreate the pain. We can't change the pain. We can't make the pain better or worse. We can't do anything with it, at all. And so when we're dealing with someone that might have autoimmune type symptoms after we're doing an evaluation, we start asking questions like, are you bloated? Do you feel fatigued all the time? Having a hard time sleeping? Even healthy foods, are you noticing those make you feel sick? And so they'll start saying yes to a lot of these and going like, how did you know? Like, I've been to so many different doctors and all my blood work comes back normal. And they say they don't know why. And they're like, they don't believe me. I mean, I've had people that like this and they've been sent to like a psychiatrist. And I'm like, no, I totally 100% believe you. We just need to get you to someone that can actually fix your gut health. And we have places that we send people to. Chronic stress and emotions, those are very different. They will present with mechanics, and we start addressing those mechanics and they get better, but their symptoms aren't getting better. Like, they can come into the office and it's like, let's say they had knee pain and they can go up the step now and they have no pain. We can't reproduce it, but they still get their knee pain. And then you start asking, when do you get it? Well, I get it when I'm working. And I'm like, oh, okay, what's going on at work? And then you'll just hear all these, like, they're so stressed and they're under pressure. And the other common thing that you'll hear is like, yeah, I go on vacation, it goes away. But when I come back again, it comes right back. And I'm like, those are all like signs for us that, ooh, there's probably an emotional component to it. How we like to share this with people is like, you could have had something happen in your life. It's kind of like, you hear a song and that song will take you into a movie that you saw 5 years ago, but you can visually see exactly in that movie where they're playing this song. Same thing happens. You can have triggers that are going to trigger something that happened in your life a while back that you have to address that piece of it. Otherwise, you're not going to address the symptoms that you're getting. And so all these different things we have to look at, because if you are hitting it the wrong category, then you're just treating a symptom. So I like to go through a lot of these because no one really explains this very well. And we get people, I'd say probably 2% of the population that comes through our office every year will have either autoimmune or some sort of a chronic stress, emotional piece to it. A lot of times when we can put them patient in control, that goes away. But sometimes there's things, and again, we have places that we send people to, that do pain management specifically for like cognitive behavior type therapy. Works really well. We've had clients that have used them and they've done fantastic with them. So we have places that we send people to, when when people have some of these issues. So again, let's go into like why surgery leads us to more surgeries. It's because no one's getting to what you did. So most of the time when people have back pain, it's I woke up one day and started hurting. I'm not sure what I did. Maybe 2 days ago from me lifting. I don't know. I've had people say I was fine. I just threw socks into a suitcase, like it wasn't even very heavy, and my back went out. Well, you were probably doing things, multiple things throughout the day. You know, day after day, year after year, same kind of positions and postures, and that was just the last straw that happened. So that's why it's really, really important to like if you have back pain, getting to someone that understands what's going on so that you have those understandings. Because if you have the surgery and you go right back to the same things that caused the pain, then then you go back and you're like, yeah, it didn't work. And then the doctor's, yeah, I'm not surprised. This happens all the time. We need to do another surgery. We just need to be a little bit more aggressive, or we need to do a fusion, those kind of things. So those are things that do happen. So it's always good to get to someone that understands this before trying any kind of surgical path. MRIs are uh, the worst. When you look at the research on MRIs, they're not great. I mean, if how I usually tell patients is if you're going to change the course of what is going to happen, then get an MRI. So, for instance, we think they tore their ACL. Well, if they did tear their ACL, we're going to need to have surgery. If they didn't, then we don't need to have surgery. We need to figure something else out. But you're deciding whether that's something that you have to do or not. Like an MRI is going to be needed on something like that. But when you look at MRIs in general, when you look at the research on MRIs, if you took 100 people and they have no pain whatsoever, 60 to 80% of them are going to show something. And it happens as that number goes up as we get older. So you'll take someone that's like 12 years old and you image them and they're not going to show anything. And if they do show something, I'm like, yep, you probably have that going on because they don't have the changes that go on as we get older. And so some of the changes that happen as we get older, it's just like us getting wrinkles on our face. It's just a part of aging. So what they find is they see a part of aging. So you'll get degenerative changes, herniated discs, you'll get stenosis, you'll get some of these things that is that really what's going on, or is there something else that's causing your pain? And so this is where we don't rely on MRIs to see anything unless we're like, you're not a typical patient, you're not responding like in a typical way. Let's definitely get into the doctor and do some further testing, and then we can sit down and talk and go like, that makes sense, that doesn't make sense. So based on our evaluation, you probably have something going on here. But if you have like red flags, which would be, infections, or we think you have like cord compression, you're going to know. I mean, your symptoms are very different when you have like spinal cord compression, when you have those kind of things, or something like sinister, cancer, something like that. If you're showing signs of like red flags, definitely MRIs are going to be the way to go. You're going to see those things and you're going to be able to correlate that with, yep, that's where the symptoms are coming from. But overall, in general, it should not be the first piece of thing that we do, because it's just going to lead you down to more procedures and frustrations when in reality we don't need an MRI to determine what we need to do. So again, if we look at like how posture plays a role, you can see here like good posture, the spine has its natural curve. We always use like a lumbar roll through here when we sit, so that we can maintain that natural curve. But most of the time we look like this. And so if we're like this for 8 hours and we're always bent, and then we come home, we sit on the couch, and then now we're cleaning something or we're doing gardening and we're always bending, our joints will get stiff and we'll start having problems. And then you will start getting like herniated discs and those kind of things. So posture, what you do repeatedly is important. And that's one of the things that we look at. Other things that we share when people have a sitting job is to stand and work, because you can stand and your spine's definitely in a much better position when you can stand and actually work. So this table that we have here, it's just a bedside table. Like this, I think it's like $60. Really easy to use if you need to for a laptop to elevate it. Then if you aren't going to use it, you can also use it. It's because it rolls and you can put it on your side and make your desk even bigger to work with. But it's a great tool that you can use if you're having some back pain to help you feel better. This is an exercise. So a lot of times, we do a lot of bending. So a lot of the directions that we're trying to open people up in will be extension because of the bending forward. Now, it's not always the only direction that we go into. There's times when you can get herniations more lateral. There's times where we have to go up into the ribs. There's times when we need to do a little bit more into our hip. But overall, if you just go in and do press ups, which is this, where you're pressing up and then coming back down, and you do that like even 10 every day, if you have no back pain right now and you're just doing 10, they have research showing that it will help keep your back pain away, to where you'll continue to feel good. Again, if we can get the joints to stay mobile and moving, you're going to have less stiffness. So this is a great one to try. There's other ones that we do with clients too that work really well if people don't have the arm strength to do the press ups. So, what are some other lifestyle changes that are missed with our healthcare providers that our healthcare provider misses? And one of them is lifestyle changes. And again, it's the postures. It's what are you doing repeatedly? We've got to bring awareness around that. They only look at the site of the pain. So they never get into like other areas because we always say like where the site of the pain is often not where the source of the problem is coming from. And there's a lot of different sources and a lot of times there's combinations of things. So you can't just only go to the side of the pain. Otherwise you're missing the boat. We had a client that came in and everyone was like, "Yeah, it's back pain, it's back pain, it's back pain." And this particular client, it wasn't back pain, it was hip pain. And I'm like, "Nope, this is a hip pain, this is a hip issue." And we were addressing it and she was getting better, but she eventually needed to have a total hip replacement. But she had been for 10 years going from surgeon to surgeon to surgeon, and everyone focused on her back. And it really was a hip issue. So there's times when back pain can be coming from the hip, and that's the main source of it. So you've got to look at the whole body, only looking at the injury one way. So it's like, for example, you're only looking at it from a massage perspective, or like a lot of PTs is only doing strengthening, or chiropractors only looking at the joints. You really have to look at it from all angles to get it. And so that's one of the healthcare misses that happens out there. Surgery does not always give you answers as to why you had your back pain in the first place. So don't fix that. If you don't fix that, your pain will return. So again, that's what leads you to more surgeries. Shockwave, which we're going to get into here in a second, focus and radial. We're like one of the few clinics that actually offer this new technology, and it's been amazing. I've actually have used it on my knees. Which were horrible. And I did not want to, I have friends that had a total knee replacements in their 50s, like low 50s. And I was like, I am not going to be that person. And I actually used it on my SI joint as well. And so we'll talk a little bit about my results on that. So, what is shockwave therapy? So, it's basically it's a modality. It has an 82% success rate. It stimulates healing. So, stimulates healing like 50% faster. The focus shockwave. So, there's radial shockwave and focus shockwave. The focus shockwave actually stimulates stem cells. So, it produces your own body's stem cells for healing. And it increases the microscopic circulation. So it works on bone, muscle, tendon, and ligaments. So how I like to describe it, a lot of times as we get older, we do get some degenerative changes. And what happens with some of those things is maybe you had an injury there and it stopped healing. So now you don't have a blood supply, which basically is why it's degenerative. You don't have a blood supply. That could happen in the bone. That can happen in your tissues. And so what shockwave does is it revascularizes those areas. It brings blood vessels back into those areas, and it brings all the healing components. So even if you had something that was recent, like you had someone that came in and they had a recent ankle sprain or a recent muscle tear, you can when you do shockwave on it, it's like bringing all the healing components to that area without damaging that area again and again and again every time we do it. So that's how it speeds up that healing. So what radial shockwave is it uses acoustic pressure waves to stimulate healing to the injured, scarred, degenerative tissue that is very broad. So I like to say it kind of makes that tissue new again. So if you don't feel anything when we're doing a shockwave, it means the tissue's not damaged. So sometimes we can use this like, there's nothing here. And other times it's like, yep, you'll feel it instantly. And sometimes you can feel it refer down into areas like, yeah, that's where my pain goes. And I'm like, yeah, that's the tissue that it's damaged. And it'll actually refer to where you actually feel pain in a very common pattern that you normally feel it in. The radial shockwave does all the soft tissue. So it is going to do like your muscles. That's what we'll use it for. So if we're going to treat someone in their back or it's their SI joint that's an issue, the radial shockwave we will hit either up and down the spine, or a lot of times when with SI stuff we will go along the SI joint, the muscles like where it attaches. A lot of times that area is super tender. What we also will find with SI joint when people have pain on one side is like you'll have springiness on one side, but not on the other side. The side that's hurting, you'll notice that it won't move as well. And that's what I noticed. It's really common to have SI joint stuff because, like for me, I had my right knee was so bad. So I was using my left side all the time. So you can imagine if you're using your left side, you're not balanced, you're going to get a little more shearing, which is kind of what happens. And so when you get, my pelvis was completely aligned, no issues. Like it was aligned. It wasn't like it was rotated or anything like that. But I had bony changes through the SI joint, and it came down to like me having a really bad right knee, having multiple knee surgeries on my right side, and my left side was taking the brunt of all the force. And so you'll get a lot of shearing. So that's with the radial shock wave, we will use it through those tissues. The focus shockwave is going to be more like the name, focused. It uses high energy sound waves to target tissues. This is the one where we can go deep. So this is where you can go deep into a hip. You can get into the hip joint. So we've had people that are trying to avoid like total hip replacements and things like that, and we've been able to go deep into that hip joint to heal the bony parts that basically have a lack of blood supply. That's why they're hurting. It's not the cartilage that's the problem. Cartilage doesn't have a nerve supply or even a blood supply, which is why you can have someone, their image looks horrible. And you're like, how are you not in so much pain? Like, I don't get this. And then you have other people whose imaging looks really not bad, but they're in so much pain. And it's because it all depends on what the structures are around that joint is happening. And so the focus shock wave will actually put blood flow back into where the bone parts have no blood supply, and you'll feel it. It's a deep ache, and it's the focus shock wave is pinpointed. So if you move off it slightly, you'll move off the area. So we're always constantly like, can you feel it? Is it going away? As we're finding the spots for you. The focus shockwave is the one that produces stem cells, but also improves the collagen synthesis and protein synthesis, which is all like the healing components. Things will actually heal much faster. So this will treat the underlying pathology. So when we use the radial and the focus, and then we have like a PMF mat, which basically is that increases that microcirculation in the whole entire body, but we can specifically target areas that will flood those areas once when we've gotten those new blood vessels formed. It's like magic. It works really well. So common misconceptions of shockwave. Um, I don't have time to use the machine. So typically it's just so we do once a week times 6 weeks. Now I know someone that doesn't live here, and they used to live in Dallas. We have someone that came from Colorado to do this, and we've shortened the time. So we've had them go like, Monday, Friday, Wednesday, Monday, Friday, Wednesday to get all the treatments in. So we can make them into a shorter period of time. But typically when someone lives here, we do once a week times 6 weeks. If it's painful, we're using it incorrectly. There is going to be some discomfort. We guys call it discomfort. You kind of feel it. But we're all constantly asking, how is it? Do we need to go up? Do we need to go down? Because we're adjusting it. Because as we're moving through different tissues, you're going to have different intensities. Because when you have damage, you're going to feel nothing until you feel the damage, and all of a sudden you're like, oh, whoa, I feel that. So we're having to adjust it. But once we kind of know, there's a sweet spot for it. You don't want it too low. We don't want it too high. But there is a sweet spot. Then we kind of know where the targeting area is, and it's easier for us to find those areas. It's only for chronic injuries. It's great for chronic injuries because chronic injuries usually don't have a blood supply, but also you can use it within 30 minutes of a very acute injury as well. It's only for tendons. It's for tendons, muscles, ligaments, bones, They actually have different shockwave units than what we have for brain and heart. We actually can do shockwave for the nerves too. We've done that with like people that have weird like headaches. We'll do it in their suboccipital area. We can do it up there, and we've gotten some results with that as well. It doesn't have to be a last resort. I can tell you when someone comes into our office, we do an evaluation and we will determine whether, yeah, Shockwave's going to be, you're going to be a good candidate for this, or no, let's get some things moving first because I think we might be able to get you better, faster doing, if like joints aren't moving, we can get you, moving a lot better and teaching you what you can do. So sometimes we won't say Shockwave is the direction that you need to go into, and other times we will, but we're very candid when we do the evaluation, and we have to do the evaluation because again we've got to figure out where is it coming from, because again if you're shockwave in the back and it's coming from your hip, then you're basically just you're not treating anything. So it really is important for us to understand that. um, and it doesn't cause any damage. We've had people that have been sore, but the soreness is like not any different than you getting a massage and you have some soreness after that. Same thing can kind of happen with shockwave. Not on everyone. It's very we don't see that often, but it does happen. And I'm hoping you guys can hear this. I may have to. Yep. Okay. We're going to listen to this. So this is a SMU swimmer, and he had chronic back pain. He'd been to multiple PTs before coming into our office, and we got him moving pretty well. A lot of the stuff, the back was a problem, but also his hip was a problem. And eventually, we're like, let's just do some shockwave. We had just gotten a radial shockwave unit, and so we used it on him, and it was a game changer. So here's his experience.
Hmm.
I know, like, you're doing well, and it would kind of come back, and we'd need little tune-ups, and then it kind of started creeping back in again. It was
Yeah.
slightly different. And that's when we talked and said, hey, we have this shockwave um, treatment that we're doing. And I think this is something that can really help you. And you're in the middle of like potentially getting an injection, so which ended up not happening. So tell us a little bit about the shockwave and how, because I think it was only 4 sessions and it was like gone.
Oh
Tell us
yeah.
a little bit about your experience with that.
Yeah. So obviously, like this injury has been really stubborn, and so I tried a lot of things, and Stephanie tried a lot of things too. And like around March, like there had been like the symptoms that I was feeling like last year kind of came back, and I was getting really worried. And because I've done like basically everything with Stephanie, and I've done exercises and everything, and she proposed that we do shockwave, and so we tried it. And after the first week, like just the first week alone, I already started to like see differences, because usually after like a kick set and swim practice, like I usually can't complete it, and the next day I'm like dead. But like the shockwave, like just after 1 week, my practices with kick practices, like I was able to last longer, and then afterwards, like I just did a few presses and I was all good again. So shockwave, I loved it. And yeah, it was only 4 weeks, 4 procedures, and basically like I'm pain free. Like this is the best I've been
I'm
since.
like in a lot, like this is the best you felt.
Yeah, yeah,
Yeah.
this is the best I felt.
Um, so when you look at like Shockwave does a pro-inflammatory, it promotes basically the removal of a lot of the damage. So when you bring all the good stuff in that has all the healing components, you also have to take the bad stuff out. So it will speed up that process. It also has a rapid increase of improving your collagen synthesis. Again, it has a 50% speed up of healing because of just bringing in all the good stuff to help with the healing process. It's kind of like if you have like an ankle sprain and you have from that you get all the good stuff that goes in there that's trying to repair everything. Well, every time you do the shockwave, it's doing that again and again and again. And then a big thing is it increases the vascularization. So that's that bringing in new blood vessels that go into tissues that have lost their vascularization because they've become degenerative. And then it increases the tensile strength. So the collagen synthesis and the vascularization gives you really good long-term benefits with that. The other thing, so this has a lot of big names, but the biggest thing is it again stimulates the growth of new blood vessels. That's that revascularization. And it also enhances bone formation. So literally, like when we use this on the knee is a perfect example of this because it's so it's just it's so bony all around that joint that you can get to it. It takes the bone edema away like that. Like it's fast. And the other thing that it does, because it has an anti-inflammatory effect, it decreases the inflammation, it increases the immunity, and tissue regeneration. So it has a regenerative effect because of those stem cells that it produces. They had research showing like someone's Achilles tendon that was really bad. It was very it probably, I mean, I'm surprised they didn't have surgery on it, but they did shockwave on it and they actually could see the tendon getting thicker and thicker and thicker, which is part of the regeneration process. So what is it and where can we treat this? Most evidence is with the tendon and bone healing. Achilles, plantar fasciitis, patella, trochanteric pain in the hip, shoulder and elbow pain, muscle and ligaments like muscle tears, degenerative tissue, ankle sprains, any kind of recovery from sport, lower back pain, SI joint pain. We can also do thoracic and cervical, but usually you're doing radial for those. The focus can go so deep that you don't really want to do that in the thoracic spine, just because it can go so deep, it can actually puncture a lung. We don't want that. But it's great because you can get it so deep and it can go into hips and things like that. So osteoarthritis of knees, hips, ankles, fingers. Oh my gosh, fingers. People that hurt so bad, we're able to take the pain away like so quickly. That's been an amazing thing that we've seen as well in our office. We went to a conference and listened to a lot of the top doctors that use this equipment and other types of regenerative type of equipment. And this is where they used shockwave, and they basically looked at like where the body parts they used it most in their office. And I just wanted to point out like SI joint, the right and the left SI joints, like that's a big area. 22% of it was SI joints, which I thought was interesting because we've been looking at that more and more in our office, wondering like, I'm wondering if some of this back pain's not coming from that. Hip is another big one. Knee, I would say knee, fingers are big in our office, knees, hips, and even like back and SI joint, shoulder, rotator cuff. We had someone that like had literally tore. I mean, he could barely move it. It was from a fall. He fell off his bike, tore his rotator cuff, couldn't move his arm. We did 6 treatments on his shoulder for his rotator cuff, and he was fully like his range was all the way back, and then it was just a matter of getting him stronger, which never would have happened with us just doing therapy on him. So again, 6 treatments once a week. Usually the first treatment, you'll get hopeful, you'll get some results, and people are like really excited. Every body part we find is a little bit different. Um, what we'll find too, like on visit 2 through 4, sometimes you're wondering if it's working. And then you might feel like a little bit of bone bruising. You definitely do that with like knees. We've noticed that. But around visit 5 and 6, that's when you'll notice some better results, especially when if we're using the focus on the SI joint. Even if we're 50% better, we wait 3 months because you'll still get the full effects of stem cell production, collagen production, protein synthesis for 3 months after the treatment. And so then we have people come in for a 3 month checkup so we can just see kind of where we are with everything. So the step-by-step strategy is we physical therapy, we do an evaluation to kind of figure out what we want to do. We use the beamer or it's a pulse electromagnetic field that helps with that microcirculation. We use that with the radial shockwave, with the focus shockwave, and then physical therapy if we need it afterwards. Sometimes yes, sometimes no. It just depends on kind of what's going on with people. And so, for the most part, what do we take from this? Most injuries don't require surgery. There's so many things that you can do without having to be doing surgeries or medications. Again, we do 200% more back surgeries in this country. Most of the time, no one gets the source of your problem and why it's happening. MRIs and x-rays don't help us in guiding the treatment and resolving your back pain. We have shockwave therapy to help heal with arthritis and speed up the healing. And then there is hope that you can get back to living life again and doing what you love, especially when you can see a back pain specialist. And I want to emphasize, like, even when we do an evaluation, there's going to be times where no, physical therapy is going to be the better option for you. We're going to be able to do things and show you things that you're going to be able to get back. And there's going to be times when we're like, yep, I think we should go down the shockwave route. So not everyone goes down the shockwave route. When we do the evaluation, we're going to be very clear with what we want to do for the next steps. So for the people that have showed up today, we have a free discovery visit where you can just sit down and talk to us and go through like your case specifically. I think I've gotten most of some of the questions answered. Um, with things, but I'll open it up here in a second to you guys. So we will definitely get a hold of everyone. If in your email, you'll see that comes in after this event, you'll see where you can actually sign up for discovery visit, but we'll also reach out to everyone to see who's interested. I know some of you guys that are on here actually are in physical therapy with us already. So that's great. You'll get $100 off the evaluation if you book in the next 15 days. You guys can get a copy of my book as well. And then if we do shockwave, even if we're like, we don't do shockwave initially, and let's say we said, no, we want to do physical therapy, but then we did shockwave later, you'll still get the $50 off, but you'll get $50 off the first treatment of regenerative therapy. And then you'll be getting a free back pain report as well coming through here. This is another testimonial. I'm only going to go through probably the first couple of minutes. He did not do shockwave. We did therapy on him and he did fantastic. 10 years of pain, probably more than 10 years, probably 20 years of pain. Numerous chiropractor sessions that he did. And he was with us for like eight treatments and he was back to feeling amazing. Hey guys, Stephanie here with Empower Physical Therapy, and today we have Zach, who's one of my past patients. Well, still patient, almost done with everything. But I really wanted him to come on so he could really kind of share his story because I know stories really impact people and really can give people hope that there is something out there to help, with whatever pain you have. And Zach came in with some back pain, and I'd love for him to just kind of share a little bit about like how long. Were you hurting? What did you try? What were some of your fears? Let's start with some of those.
So I'll tell you a little bit about my back pain. So professionally, I am a chef and an event planner. So I'm on my feet like all the time. I'm sitting right now for the only time today. But my back pain started when I was very, very young. When I was about 7 or 8 years old, I was a competitive swimmer, and coming home from swim practice one day, what I now know, obviously didn't then, but my rhomboid froze up. And in that process, there was a giant fear created around back and excessive back usage and all of these things. But additionally, it was like there was a constant problem. Now, when I was little, it wasn't always there. It really wasn't until I became an adult that I started really, start having more problems with it. So literally, I'm 51, so it's been 40 plus years of back pain that I have experienced on and off. And when I came to see Steph, it was amazing. The first consultation, she really got clear about what was going on and why and all of that. And magician, I'm just telling you.
What have you tried before in the past?
Everything.
Yeah.
You name it, I've done everything. Yoga, Pilates, which both really help a lot, I have to say, but it never solved the problem. Yeah. Like I could manage it, but I couldn't solve it. And like I can't even tell you how many when I discovered chiropractic when I was in my early 20s, I was like, okay, now this is the way I'm going to go. And it was, but 500 chiropractic appointments later, and I still there's still a fear around. There was still a fear around it, and I wanted to be able to self-manage it in a way, and obviously I can't, crack my own back or my own neck in the same way. So this gave me the tools to really take that on personally. I travel a tremendous amount, so it's really important when I'm on the road that I can literally be in a hotel room and just bang. And now I've got my little tricks and my little elastic. Yeah, I got all my tricks.
So again, we'll get questions that you guys have.